What are some common misconceptions about syphilis? Now that's a question that opens up a can of worms. Let's sift through the myths and misconceptions that have been swirling around this sexually transmitted infection, often shrouded in misinformation and misunderstanding. First up, we have the myth that syphilis is a disease of the past. Many believe that syphilis is something that was a problem in the olden days but isn't anymore. This couldn't be further from the truth. Syphilis is very much a present-day concern, with cases reported globally every year. It's not a relic of the past but a clear and present danger. Next, we have the misconception that syphilis is not serious. This is a dangerous belief to hold. If left untreated, syphilis can progress through stages, leading to serious, sometimes irreversible health complications. It can affect the heart, brain, and other organs. And in pregnant individuals, it can lead to severe complications for the baby. So let's be clear, syphilis is indeed serious. Now let's address the third myth, the belief that syphilis can't be contracted through oral sex. This is a fallacy. Syphilis can be transmitted through all forms of sexual contact, not just intercourse. It's a bacterium that can enter through minor cuts or abrasions in the skin or through mucous membranes. So yes, it's possible to get syphilis from oral sex. These are just a few of the many misconceptions that surround syphilis, a disease that remains misunderstood despite its prevalence. It's vital to separate fact from fiction, to understand the risks, and to know how to protect ourselves and others. Now that we've debunked some common myths, it's time to delve deeper into the reality of syphilis. So, what exactly is syphilis? Syphilis, a name that often sends a shiver down the spine, is a sexually transmitted infection. It's not just something from the pages of history books or a problem confined to far-off places. It's a present-day reality for many people around the world. It's a bit of a shapeshifter, this infection. It progresses through 4 distinct stages, each with its own set of signs and symptoms. The primary stage is marked by the appearance of a small, painless sore, often unnoticed due to its inconspicuous nature. This sore, called a chancre, is the bacteria's way of setting up shop in your body. As we move to the secondary stage, the bacteria start to spread, causing skin rashes and lesions, often accompanied by fever and fatigue. It's a bit like the bacteria throwing a wild party, and your body is the unfortunate venue. Then we enter the latent stage. Things seem to calm down with no visible symptoms. But don't be fooled, the bacteria are just lying low, biding their time. Finally, we reach the tertiary stage, which can occur years after the initial infection. This is when serious complications can arise, affecting the heart, brain, and other organs. It's like the aftermath of that wild party, a lot of damage and a big mess to clean up. And here's the kicker. Syphilis isn't just transmitted through sexual contact. It can also pass from mother to baby during pregnancy, a condition known as congenital syphilis. This can lead to severe health complications or even death for the baby, which is why regular testing during pregnancy is so important. So, you see, understanding syphilis is not just about knowing the name of a disease, it's about understanding a complex, multi-stage process that can have serious, long-term effects if not detected and treated early. Having understood syphilis, it's time to look at why regular testing is so crucial. Why is regular testing for syphilis so important? That's the question we're going to delve into right now. Syphilis is a sneaky infection. It progresses through stages: primary, secondary, latent, and tertiary, each with varying signs and symptoms. In the early stages, it can often go unnoticed, masked by symptoms that resemble common ailments. This makes regular testing for syphilis not just beneficial, but crucial. Let's consider a scenario where regular testing isn't conducted. Syphilis, left untreated, can lead to serious health complications. We're not just talking about rashes or fevers. In its late stages, untreated syphilis can cause damage to the heart, brain, and other organs. Complications that can be life-threatening. But this isn't only about individual health. If we zoom out, the importance of regular testing becomes even more pronounced, especially for pregnant individuals. You see, syphilis isn't a solo player. It can be transmitted from mother to baby during pregnancy, causing what's known as congenital syphilis. This can lead to miscarriages, premature births, newborn deaths, and severe physical and neurological problems in babies that survive. It's a grim picture, but one that underscores the importance of regular testing. Now let's flip the script. What happens when regular testing is performed? Early detection. This means the infection can be nipped in the bud before it escalates. Syphilis is curable with antibiotics, but the key is catching it early. Regular testing, therefore, becomes your frontline defense against this infection. So, while we may not relish the thought of regular testing, the implications of not doing so are far graver. Regular testing for syphilis can prevent dire health complications, safeguard the health of unborn babies, and break the chain of transmission, protecting not just individuals but communities. Testing is a critical step, but what happens after a positive diagnosis? Now, that's a conversation for our next scene. Stay tuned as we navigate the path of treatment and prevention of syphilis. What are the treatment options for syphilis and how can we prevent it? Syphilis, a sexually transmitted infection that progresses through stages, can be effectively cured with antibiotics. However, it's crucial to remember that reinfection is possible. This fact underlines the importance of ongoing testing and treatment, even after a previous infection has been successfully dealt with. The primary weapon against syphilis is antibiotics, specifically penicillin, which has proven to be the most effective treatment. The duration and method of treatment can vary, depending on the stage and characteristics of the infection. But it's essential to remember that treatment will kill the syphilis bacterium and prevent further damage, but it won't undo any harm the infection has already caused. For those allergic to penicillin, there are other antibiotic options available. It's essential to discuss any allergies with your healthcare provider to ensure you receive the most appropriate treatment. While antibiotics can cure syphilis, prevention is always better than cure. So, how can we prevent syphilis? The most effective way to avoid syphilis is to practice safe sex. Using latex condoms correctly every time you have sex can significantly reduce your risk. However, since syphilis can also be spread through contact with a syphilis sore or rash, condoms aren't completely foolproof. Another essential prevention method is regular partner testing. If you and your partner are sexually active, it's important to get tested together and know each other's status. This can help prevent the spread of syphilis and other sexually transmitted infections. Remember, early detection and treatment are the keys to fighting syphilis. If you're sexually active, make regular testing a part of your healthcare routine. And if you've been treated for syphilis in the past, don't let your guard down. Regular follow-ups and testing are essential to ensure the infection hasn't returned. With proper treatment and prevention, syphilis can be effectively managed. But what are the key takeaways from our discussion today? What are the key points about syphilis that we need to remember? Let's take a moment to recap the essentials. Syphilis, a sexually transmitted infection, advances through distinct stages, each with its own set of signs and symptoms. The primary stage often presents with sores, which may go unnoticed. The secondary stage may exhibit skin rashes and a feeling of general unwellness. The latent stage can be symptom-free, silently causing damage to your health. Lastly, the tertiary stage, if left untreated, can lead to severe health complications affecting various body systems. It's important to remember that syphilis is not just transmitted through sexual contact. It can pass from an infected mother to her baby during pregnancy, making regular testing a crucial part of prenatal care. Untreated syphilis in pregnancy can have serious consequences for both mother and baby. Despite its severity, syphilis is curable. Antibiotics, if taken correctly and at the right stage, can eliminate the infection. However, treatment doesn't provide immunity. You can get reinfected, which underscores the significance of ongoing testing and treatment. And let's not forget prevention. Safe sexual practices, regular testing, and open communication with partners can significantly reduce the risk of contracting or spreading syphilis. In conclusion, understanding syphilis, its stages and symptoms, the necessity of regular testing, and the options for treatment and prevention are the key points to keep in mind. Remember, knowledge is power. Stay informed, stay safe, and take care of your health.